Francisco should be aware.
Kaiser is unfair.
Hey, San Francisco should be aware.
Kaiser is unfair.
Hey,
We're here because we care about patient care. We want better staffing by Kaiser management. We want them to sign our contract after so many years. It's been 4 years now.
I want to introduce Sal Roselli, president of our union.
First thing I want to do is recognize our 300 optical workers across Northern California that are striking today and don't get the recognition they deserve. And their issue is staffing too, just like everyone else. Not enough staff to care for Kaiser patients. For the first time, NUHW was able to go to the bargaining table with you as NUHW and talk to Kaiser about the staffing crisis that goes on every day. And the fact that Kaiser every day breaks the law and doesn't provide adequate, times for people's appointments. Kaiser didn't want to talk about it. So our union surveyed scores and scores of clinicians and your co-workers throughout the state of California and produced a white paper, Care Delayed, Care Denied. We used their documents to produce this paper and your experiences. So we took it to the Department of Managed Healthcare. That's the agency in California that regulates Kaiser and other HMOs, right? And while it took way too long, it took 2 years of them investigating it, which is a demonstration of Kaiser's inappropriate influence with government. Finally, they came to a conclusion that, in fact, Kaiser was breaking the law. They ordered Kaiser to stop breaking the law, seeing patients as required, and fine them $4 million. You remember when that happened, right? That was in 2013. So Kaiser appealed it. And when one appeals this kind of a thing, there's supposed to be a really quick hearing before a judge, right? Again, Kaiser got that delayed for another year. And finally, in September of last year, an administrative law judge ruled that the trial was going forward, scheduled 2 full months for a trial. And we lined up many of you and many Kaiser patients that were ready to give testimony about the crisis, the scandal, the horrendous situation that's going on. The day before this trial was supposed to start, Kaiser went to the judge and made a motion to keep everything behind closed doors, not open to the public, right? The judge ruled against Kaiser, ruled in our favor, said everything's going to be open to the public, and that night on September 8th, Kaiser changed its position, admitted to guilt, and paid the $4 million fine to prevent all of this from going public.
We've had 2 previous one-day strikes that obviously did not help. So the leaders, workers decided that an escalation was necessary, just to try to get press attention, community attention, to shed the light on this critical situation.
Now, there have been some suicides as a result of people not getting care.
Oh, scores of suicides. And there are 4 class action lawsuits, 4 separate class action lawsuits statewide of families of patients that committed suicide. There are 3 elected leaders that have come to us. Supervisor Shirley Zane in Sonoma County, whose husband committed suicide during a time where she was very frustrated not being able to get a timely appointment. We just heard from a city council person in Milpitas who, in a very frustrated way, she was trying to help her sister get a timely appointment. Kaiser finally gave her an appointment 6 weeks out, and 2 weeks into that, her sister committed suicide. It's like how it reminds me of Wall Street corporations. No amount of profit is enough. That's what we're seeing here. Every year in the last 5 years, they've broken profit records, $15 billion in profit over 5 years. They have a $32 billion cash reserve and not putting adequate resources into staffing mental health.
Is this part of the law?
They're breaking many laws. For example, it's a law that when a patient calls in for a mental health appointment, they're to be given one within 10 business days. That's the law, right? Kaiser doesn't do that. And they force people to cook the books, much like the VA scandal did, right? That's what we exposed that caused the $4 million fine. So now what they're doing to trying to get around this is they're transferring more people into giving people an initial diagnostic appointment to try to do it within 10 days. But then once the diagnosis is made and it's determined that a person needs therapy, they often have to wait 2 months before they can't get an initial therapeutic appointment, which is also against the law. So it's the next thing that we're working with the state to expose.
Do you think there's a criminal conspiracy to violate the law?
I absolutely believe that there's criminal activity, and that's why we've called on the Attorney General to do a criminal investigation. Nationally. No, this is national, governed by federal government. No, but it's governed by the federal government, these laws. We believe that investigation is happening.
And you said you had a problem getting this report in California about what's happening
We have a lawsuit in California Superior Court against the healthcare exchange that administers Obamacare. They tried to get that lawsuit dismissed. See, Kaiser's violating the exchange's rules for participation in the exchange, right? So the judge rejected their dismissal motions and said the trial's going forward, and then ordered the discovery process to happen. We demanded all kinds of information to gather evidence about our accusations. For many, many months, they refused to give it to us. And just recently, the judge gave them an ultimatum and an order to give us the information. So we're just starting to get that, but we'll get more evidence.
Carrie Levin. I'm here because I care about my patients and I want them to be able to get in sooner and get more timely appointments and returns that aren't 4 weeks out.
Sanmeet Singh, definitely fighting for patients' care, not their ability to access a therapist and get help for their families. There are a lot of people out there with some serious mental health problems that need support, and so I'm out here for our patients. It's really sad to tell people that I have no appointments available during the holiday season from December 15th. I had no appointments available in December or January, and I had to collect from every patient from then on until the rest of the, until February appointments were available. I had to put them on a wait list.
My name's Bria.
What kind of work do you do?
I'm a psychologist.
And so, what do you think about what's happening today and why it's important to the people in California?
I think it's really important. I think, standing up for patients' rights and care, because I don't think that there's enough access. We can't practice in the way that's healthy and needed and necessary for what patients are needing.
And how has the lack of staffing affected psychologists here at Kaiser?
Well, because we have an abundance of patients coming in, especially with the new healthcare plans, and so we're not able to see them as frequently as they're needing. And their needs are really important, and they're not being met at this point because of access. We just know what's important, and that's patient care and rights, and that's what we're standing for here today.
I'm Dr. Andres Skoya, and I work at Kaiser Oakland. I'm here because I care about patients, and that's my life's calling and my work and my training, and we're not able to practice and provide the kind of care that these people who come to us for help deserve, need, and for what they pay for by their premiums or whoever's paying their premiums on their behalf. And that's just wrong. And that some of these patients are very troubled and have major life problems, illnesses, depression, bipolar illness, conflicts in their family, and they stand to be damaged and lose a great deal of the quality of their life and jobs and relationships, and things fall apart when people don't get good treatment for mental health problems. I have, and it's a heartbreaking thing to tell a patient that. I had an African-American man who came in, had never been in therapy in his life. He was like a big linebacker, a tough guy, worked in construction, developed a bout of depression, promised himself that he'd never be like his father, who was alcoholic and abandoned his kids, and here he was several weeks into this depression. He was screaming at his kids about and being threatening to them, and that shook him up so much that he came in for treatment. And when I was sitting there and he was telling me this this quiet tear forms in the corner of his eye, this big tough guy, and I was heartbroken because I knew I could not get this guy back in to see me in enough time. I could send him for pills, maybe I could send him for a group. Fine, that works for some people, but this guy had major depression. He's going to need more traction, and that's my training. I've been at this for decades, and I wasn't able to do it. It was heartbreaking for us to do that. And unfortunately, we're not able to provide that in many, many cases. And that's just wrong, and that's why we're here.
seems like, there's a serious mental health problem in the United States. You have violent actions, you have people who can't get health care and end up doing violent things. It sounds like a national health problem.
Well, it is, and you're absolutely right about that. It's a big national health problem. You only need to look at the, Sandy Hook, killings and many similar instances, the VA and so forth. So that all the more underscores why Kaiser, a very successful model in many of the things that they do, ought to become a leader and take the forefront and just do the right thing in this case, and do the ethical thing and the morally correct thing in terms of providing care for people who are generally vulnerable, who aren't able to advocate on their own behalf as effectively as others of us are. And it underscores the point. It is a national problem, and it isn't, certainly Kaiser isn't unique in it. However, we do have a contract that, when people sell insurance, that they're supposed to get something in return from it. And there is laws, such as the state laws, that require certain access, and Kaiser doesn't meet its contractual obligation to its patients and members, and it doesn't conform with the law, oftentimes, in terms of accessibility. And we're here to say that they ought to fix that.
And it seems like if you have insurance, you think you're going to get health care.
Oh, you're right. Right.
In reality, it's getting a problem getting that.
Exactly, and we see that over and over again. People who just assume, oh yeah, I've got insurance, I'm having, maybe someone who comes in for the first time in their life. Most people don't use mental health insurance. There are some people who use a lot because they need it. It's like every other illness, if you have heart disease, you're going to be in a lot, but most people don't. But then when those people come in, they may just have a job problem, or somebody died in their family, or there's a divorce or something, and they're not really mentally ill, but they do need some help, and they are having symptoms that qualify for help, and we're not able to help those people enough. We can get them in and see them 1 or 2 times, a month later, 6 weeks later, and that is not. There's no model of therapy anywhere in the scientific literature and in best practices that says that's good treatment.
And have you personally had to tell patients you can't see them because you're all booked out?
Yes, I have, and it's a heartbreaking thing to tell a patient that. I had an African-American man who came in, had never been in therapy in his life. He was like a big linebacker, a tough guy, worked in construction, developed a bout of depression, promised himself that he'd never be like his father, who was alcoholic and abandoned his kids, and here he was several weeks into this depression. He was screaming at his kids about and being threatening to them, and that shook him up so much that he came in for treatment. And when I was sitting there and he was telling me this this quiet tear forms in the corner of his eye, this big tough guy, and I was heartbroken because I knew I could not get this guy back in to see me in enough time. I could send him for pills, maybe I could send him for a group. Fine, that works for some people, but this guy had major depression. He's going to need more traction, and that's my training. I've been at this for decades, and I wasn't able to do it. It was heartbreaking for us to do that.
What do you think the state should do about this? Because they are planning to take in hundreds of thousands more patients in, yet it doesn't seem like they're able to take care of the patients they have now.
Right. So that's the obvious arithmetic of it. Here it is that they're not able to do that, and yet more people are coming. I think it's pivotal that the state regulators are not be asleep at the wheel, and that they not, that we don't have a situation like we had at the VA or like at GM Motors, where regulators knew for years wrong things were happening and never clamped down, never really did their job in a way of being able to. And now the state and the regulators have ample evidence that this is an organization that's prone to violating the law and being deceptive and devious in some ways around these issues, and they ought to ensure that the laws are respected and the Kaiser conforms to them.
So you're saying it's comparable to the VA?
I am saying that. And so is the process whereby the VA, they had all these reports and investigations, and all the internal things kind of never amounted to anything until finally it became externalized by, Congress and other people. Now, a lot is being done. People are being hired and so on, trying to fix that problem. And we hope something similar to that would come about here.
Obamacare was supposed to help people, and people aren't getting more health care if hundreds of thousands of people are doing it. Yet it seems like if they don't have enough staff, they can't even help the people that already have membership
Right,
in Kaiser.
right,
So, I mean,
right.
but,
And then that's one of our worries and considerations, and we see this in the clinic, where more and more patients coming, not only just more numbers, but in a sense they're sicker, in a sense there's more acuity, they have higher symptomatology because they haven't had care for a while. They're usually signed up and things that have been let go. So once depressions and other kinds of anxiety, panic disorder kind of set in, they become more refractory, more difficult to dislodge the longer they exist. Right. So these are tougher patients who are going to require more care and more time and energy, and that's and Kaiser's moving in the other direction. They're giving us less time, more patients, sicker patients, and less time to help with.
And what is the cause of that? Why are they moving in the opposite direction?
Well, I mean, you would have to ask them, although I'm sure they would deny it. They would spin some numbers out. But, we're there on the front lines. We're there in the clinics. And, this isn't about that we want to get better dental benefits or something like that. We're not out here. These signs are the real thing. This is the integrity of our work and our calling. And if we don't defend and advocate for vulnerable patients, who will? And why Kaiser isn't doing that, we can presumably speculate has to do with the corporatization of medical care and the drive towards obscene profits. And I use that word not, shooting from the hip. We are talking about billions of dollars with a B. This isn't a struggling organization that we're trying to, extract more money out of. It's an organization that could really do the job and take care of its patients really well and become a national leader, and they should reward the psychologists and social workers and therapists who contribute proportionally to the success of that organization and work very, very hard. Of course we want, that as well, but that's really not the primary drive here. Because you know what? I'll be okay whether I get a big raise or a little raise or no raise, and most of the people here will somehow be okay. I mean, we may not, but our patients won't be. Some of them really won't be, and their lives are going to be full of suffering and symptoms, and their lives are going to unravel. And we just need to hold Kaiser accountable for that.
How long have you worked at Kaiser?
I worked at Kaiser 34 years, and I've been a chief of service, a manager for 7 of those years, and a regional in charge of regional things. I worked at several Kaiser facilities, so I've seen it from both ends, and I understand what it's like to be in management. And we're not naive in saying that efficiency isn't important and cost savings shouldn't be considered. Nobody's saying those things. We understand that there are hard decisions to be made, but this isn't that kind of a discussion. This has gone so far in the wrong direction. It's so skewed that it's just stunning. It's appalling that an organization would lose its moral compass.
I'm Gail Nelson. I'm a retired nurse practitioner. I worked for Kaiser for over 25 years. And we all work together. All of our departments work together. And when one department is short-staffed, well, we're also short-staffed. And I'm supporting these workers too because they need better staffing for all of our patients. There's 350,000 new patients with Obamacare, and I wonder how the employers' negotiating team is going to handle it if they have to go into the hospital.
I'm Clement Papazian, and I'm a 25-year Kaiser employee with a specialty in psychiatric emergency and acute care. I've been at this for almost 4.5 years. There are not enough psychologists, social workers, and marriage and family therapists to see the patients that they're signing up that they had before the Affordable Care Act. Now, in the aftermath of the Affordable Care Act, it's even more patients, and they're simply not responding to that crisis. And it is a crisis because these clinics are interdependent landscapes, so that if you can't get in to see your routine provider in a timely fashion, what happens is you escalate to become more acute. That means runs on the crisis service, runs on the emergency rooms, runs on our intensive outpatient services, and on our psychiatric hospitalization resources, which is tremendously impactful over the course of many years. And this is where we are. I don't know if you know Shirley Zane, who is the Sonoma County Supervisor. She's an outspoken advocate of what we're doing with Kaiser. She says Kaiser can certainly do better. Her husband committed suicide. I mean, she's very public about that. But that's just one example. And that, you know, we have 4 patient care lawsuits now with stories as egregious. So you can only imagine if there's that groundswell of support for lawsuits, that, you know, things have gotten to the point where, yes, the system is broken at Kaiser. I don't think they've conspired necessarily. I think that they've gotten used to saving on labor costs for so many years at Kaiser that now they're simply used to pocketing that profit, and it's gotten to the point where it's so bad that clinicians who, you know, come to this work as a calling, right? These are people who are educated people. They could be out there doing all kinds of things to earn money. They are saying that they can't do their job. They can't offer the services that they've trained for, and that, you know, like I say, is kind of a calling for them.
People die as a result of not getting proper treatment. You think that they should be criminally prosecuted, the executives of Kaiser? If they're preventing people from getting care, you know, and people die from that?
Yes. I mean, seriously, yes. And you know, we are escalating those kinds of avenues in response to this crisis. But it doesn't seem to really get their attention. I mean, the state regulators are involved. We're waiting for their follow-up survey, which we know is going to be an indictment of their treatment resource. Initially, it was their diagnostic resource that they focused on. Now it's going to be their treatment resource, and we know that they're not going to sustain that. 4 patient lawsuits, a lawsuit against California Covered for, you know, being allowed to let Kaiser sign up patients from the Affordable Care Act when they couldn't care for the patients they already had. So.
More, and you can't even take care of the patients now?
Exactly. That's it. And that's what we're trying to communicate to the public. They haven't been able to care for the people that are already on their rosters from the standpoint of mental health services. And that's really our biggest beef with them. We're asking for pretty much status quo on the benefits, which we've always had. Their response to our patient care ask was to say, okay, well, we're also going to now, you know, curtail the benefit package to ostensibly save even more in their labor costs. That is a good question. It's a question of the leadership. There's a schism between the leadership on the issue of coordination. And, you know, we feel that profoundly. Our rank and file members feel that. Their rank and file members feel that. And really, it's an issue to be taken up with the leadership of the CNA. Absolutely, absolutely. What I can say is that it appears that the lobbyists, in order to make manifest an Affordable Care Act, created an avenue for hospital administrators to get wealthy. Now, whether is that worth, you know, opening the door to, you know, cover many millions of the uncovered as a start? Maybe. But what we're seeing is that all of those resources are going into the money, into the pockets of the executives, and they're really not using it to increase services to the public.
It's not providing mental health care to the patients that need it. That it provides very, very limited number of sessions. And the access is not there. So it's a combination. That the Kaiser mental health programs. I work in the Department of Chemical Dependency, which is rich in resources compared to the mental health department, where patients get seen. My understanding is patients get seen once every 6 weeks. Patients who are in crisis, patients who really need very intensive care. No, it's not. No. And the staff is grossly overworked, that they're given way more patients that they can possibly handle responsibly.
Thank you for coming out today. I'd like to thank some of my fellow nurses that are on the picket line because they're in the same fight as we are. And we're here really for so many reasons. I mean, we're here to stand up to corporate greed. We're here to stand up for patient care. We're here simply for what's right. It's just a shame that the time when Kaiser is making the most profits, when they're the biggest influx of patients thanks to Obamacare, that they decide to staff us less. I mean, anybody that wants to come on any given day and looks at the lines at pharmacy, sees the patient waiting rooms, Kaiser's collecting more profit and trying to put out less. It should be against the law. It's not right what they're doing, and that's the main reason why we're out here. And I know it's hard to be out here for a week, but we have to be able to do the things that we don't think we can do. You know, I know we're taking on a corporate giant, but we're doing what's right. And as long as we don't give up, we're going to win. And what we're gonna tell Kaiser is we're gonna hold them accountable to their patients and to their workers. And we're gonna actually make Kaiser better than it is now. They can thank us later.